How prestige technology solves long-term care facilities' biggest IT issues. Introduction. Technology has become as critical to long-term clinical care as the staff who operates it day to day. Nursing homes, assisted living communities, rehabilitation centers, and outpatient clinics depend on electronic health records, EHR, connected medical devices, cloud applications, and secure networks to deliver quality care. From medication administration and resident documentation to telehealth visits and billing systems, nearly every aspect of modern healthcare now relies on always-on digital infrastructure. At the same time, federal regulators are raising the bar for cybersecurity standards as ransomware attacks, phishing campaigns, and data breaches continue targeting healthcare organizations of every size. Long-term care providers have become targets because many facilities operate on outdated technology, limited cybersecurity protections, and small IT teams. A successful cyber attack can interrupt patient care, delay access to medical records, expose sensitive resident information, and create significant financial and regulatory consequences. Unfortunately, many long-term care organizations operate with tight budgets, aging infrastructure, and little internal IT support, making it difficult to keep pace with rapidly changing technology requirements. This article explores the evolving IT standards affecting long-term healthcare facilities and explains how prestige technology helps providers strengthen security, improve reliability, maintain compliance, and focus on delivering exceptional resident care. New HIPAA standards. The Department of Health and Human Services, HHS, has proposed the most significant update to the HIPAA security rule in more than a decade. Designed to strengthen cybersecurity protections for electronic protected health information, EPHI, the proposed rule is in response to the dramatic increase in cyber attacks affecting healthcare organizations nationwide. Some of the advised requirements are mandatory multi-factor authentication, encryption of protected health information both at rest and in transit, automated vulnerability scanning, regular penetration testing, documented asset inventories, detailed network mapping, enhanced access controls, and more comprehensive security risk analyses. Organizations would also be expected to develop written policies for incident response, disaster recovery, system restoration, and ongoing security monitoring. Unlike previous HIPAA guidance that allowed organizations more flexibility in outlining their appropriate safeguards, many of these updated requirements would become mandatory baseline security controls. This comes from a refocusing effort from many regulators that IT is no longer just a technology issue, but also a patient safety issue. If clinical systems become unavailable due to ransomware or other cyber incidents, providers may be unable to access medical records, medication histories, treatment plans, or communication systems that are essential for resident care. These expanded expectations make proactive IT management more important than ever. For long-term care facilities, compliance depends on organizations having a comprehensive understanding of their networks. CMS standards for emergency cybersecurity preparedness. This push for more consistent digital healthcare standards also includes a redefinition of what emergency preparedness looks like. The Centers for Medicare and Medicaid Services, CMS, expects healthcare organizations to rank cyber attack defense alongside natural disaster preparedness. As healthcare systems become more digitally connected, cybersecurity incidents can disrupt operations just as severely as natural disasters. CMS guidance encourages healthcare providers to incorporate cybersecurity into their emergency preparedness programs. Facilities are expected to develop continuity of operations plans that ensure essential services remain available even if their primary systems become unavailable. This includes making sure organizations coordinate their procedures with vendors, technology partners, and local emergency management agencies to improve response times during an actual event. Today, ransomware attacks can have exactly the same effect on digital healthcare that natural disasters do. Electronic health management systems can fail and create significant operational challenges. Preparing for these events before they occur helps organizations continue delivering quality care while minimizing disruption. Long-term care facilities face growing expectations with limited budgets. While cybersecurity expectations continue to increase, Many nursing homes and assisted living communities operate with limited financial resources and little or no dedicated IT staff. Smaller providers often depend on aging hardware, outdated operating systems, and technology that has been maintained only on a break-fix model rather than through proactive planning. In comments submitted regarding the proposed HIPAA security rule, the American Healthcare Association and National Center for Assisted Living, AHCA, NCAL, expressed concern that the expanded cybersecurity requirements could create billions of dollars in unfunded compliance costs across the long-term care industry. The organization noted that providers are already facing workforce shortages, increasing labor costs, inflation, reimbursement pressures, and ongoing financial challenges that make large technology investments difficult. Meeting new cybersecurity requirements requires far more than purchasing new software. Organizations may need to replace outdated equipment, implement enterprise security platforms, upgrade network infrastructure, conduct recurring risk assessments. For facilities with only a handful of administrative employees, these responsibilities can quickly become overwhelming. Prestige Technologies solutions for long-term care. The demand required of long-term care providers to meet the new digital healthcare standards while struggling to support their own limited IT systems under significant financial limitations is a situation that greatly benefits from managed IT services. Instead of building an expensive internal IT department, healthcare organizations can partner with experienced providers that deliver enterprise-level cybersecurity, regulatory expertise, proactive monitoring, strategic technology planning, and responsive technical support at a predictable monthly cost. Prestige Technology is a reliable companion for healthcare providers, helping prepare them for the evolving landscape of healthcare IT standards by offering top-of-the-line managed IT services. We provide comprehensive cybersecurity assessments, managed security services, secure cloud solutions, network monitoring, endpoint protection, backup and disaster recovery planning, and ongoing compliance support. Rather than reacting after problems occur, facilities gain a proactive technology partner focused on reducing risk before it impacts operations. Prestige Technology works alongside long-term care providers to maximize existing technology investments while developing scalable IT strategies that fit operational budgets. Our offerings help improve security, reduce downtime, maintain compliance, and plan for future technology needs without the expense of maintaining a full internal IT staff. Conclusion: in order to adapt to the changing healthcare landscape, long-term care organizations require an experienced IT partner that understands their unique challenges. Facilities need solutions that improve security without disrupting clinical workflows, strengthen disaster recovery capabilities, and provide dependable support as regulations continue evolving. Prestige Technology helps healthcare organizations confidently navigate changing regulations, protect sensitive resident information, and ensure their technology supports the high standard of care their communities expect.